Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Hi, friend. Thank you for tuning in to today's episode. Today, I am talking with Cody Quinlan for part 2 of our conversation. If you didn't hear part 1, go back and listen to last episode. So in part 1, we talked about Cody's journey from being an EMT to physical therapy to his current role in healthcare quality. We talk about his journey, what he does in his current role, and how he got here. In today's episode, we talk about Cody's thoughts on the current state of healthcare and where it's going. Enjoy. So how do you think we can make healthcare safer now that you're on the quote unquote other side or on the big picture side? How can we make healthcare safer for our patients and for our frontline team members?
I mean, tough question. There's a lot wrong with healthcare, and it starts in areas that we can't even touch as quality. But I think if we're trying to make a quality movement to improve the patient care experience, then we can't just look at numbers. It's very easy in this role to become a number-focused, number-driven individual, but we have to get back to the basics of what gives rise to those numbers, what drives those numbers, and it's people. So really, if you can motivate, if you can focus, and you can drive a team of clinicians, then the quality measures will follow. They'll go where they need to go. It all comes back to people. Now, how you motivate them, how you keep them driven and focused, that is a question I really don't have an answer to. It comes down to good leadership. I'm working on my own leadership skills. I am not a good leader at the moment. And so that's something I'm trying to work on, because I think that is the skill you need in conjunction with understanding quality to really drive improvement.
That's powerful. It is about the people. And a lot of times, like you said, decisions are made just based on the number, whatever that number or that metric is. But it all goes, at the end of the day, it goes back to people.
Yeah, it goes back to people. And, just kind of like on that point too, and a little bit on the side of improving healthcare quality wise, I do some outside work, side project, I guess you'd call it, regarding AI in healthcare. I think that's going to become a big focus moving forward for companies. I think it's going to be a big focus for the quality of different healthcare organizations as well, especially reducing burnout, reducing turnover. I think a lot of those issues might be solved with the introduction of AI into healthcare, as long as it's done thoughtfully, as long as it's done with patients and clinicians in mind. I would hate to see AI tech roll into healthcare with the thought of, we're going to improve margins, we're going to improve reimbursement, and that sort of mindset.
So when you say AI, are you referring to digital health or predictive analytics, or what specifically with AI in healthcare, if you can share?
Yeah, so specifically like machine learning and natural language processing. So the capability of recognizing like a conversation me and you are having right now, taking that language and turning it into usable data. This is big or may become big in home health because there's no eyes. There's no eyes or ears in the visit. What the clinician documents is what we get. So I think in a setting like that, having the capability of analyzing a vocal transcript can be super powerful when it comes to gaining new insights and quality metrics. And then the flip side is like the natural language processing used to be able to extract data from the transcript as well as any clinician notes that are written and turn that into like an automated answering system for components of the documentation. So having an autonomous answer population based on basically just listening to the visit.
I think that's very intriguing. I'd love to see where that goes in the future. I'm just thinking through that. I can see how that would be very helpful. Like you said, if it's used thoughtfully and in the right way.
Yeah. The whole goal is, I think we've really started focusing in healthcare a lot on documentation and not on the patient. And I don't know when that changed. The transition from paper to EMR, that was supposed to be a big win. Less work for clinicians, more focus on the patient. And then somehow these EHRs, EMRs, they grew and they grew and they grew. And I'm sure you've seen it. They're so massive. The requirements they want from clinicians for simple visits can be obnoxious.
Oh, 100%. And there are people who want to go back to paper, who remember when paper existed, like myself. I remember when we were in paper. But what it intended to do, there are some benefits, right? You can see, what happened in the last visit. You can see what the last doctor or nurse or therapist did in their visit with the patient. You can have some sort of continuity. And at the same time, it can be more burdensome than when you had a paper and it seemed more finite.
Mm-hmm. Yeah. And it's so easy to add things to an EHR that I think once the ball gets rolling, it's add this, add that, add this part, let's add another section here. And they just start getting bigger and bigger as time goes on. I think the next big thing is that step into AI, which is, how can AI solve that documentation burden placed on clinicians and get clinicians back to focusing solely on that patient care? And I think that brings the real clinicians out. Your inner clinician will come back, and that drive and passion for healthcare will help reduce the turnover and retention issues.
Yeah, and part of it, I think, is being able to perform at the top of our license, right? So using that clinical decision making and that clinical expertise in that session with the patient is what we long for. And when that's replaced by all the things we have to do to justify the session, then that's where I think some of the burnout may be coming from. If we could use our license to the extent, I'll just re-say practicing at the top of our license, then I think more clinicians would want to stay in healthcare or would want to stay at the bedside.
Yeah, I mean, I agree. You got into the field to be a clinician, not to be a documenter. And I get it. Documentation is important. It's part of healthcare. It's part of being a clinician. But when do we say enough is enough? Do we really need to document a fall in 3 different places? Right.
Right.
It's enough is enough. And until companies realize that, they could get good quality outcomes by maybe pulling back a little bit on how tough they are on the documentation side. There could be a lot of streamlining performed.
Yeah. And I mean, this could go down a rabbit hole, but I'll just say this. A lot of times we're documenting so healthcare has become so litigious that we're documenting for what may happen later, or we're documenting for the regulator or the regulation, that it's it's defensive documentation as opposed to clinical expertise documentation. And like I said, that could go down I could talk about that for a long time, but
I know you just opened a worm of thoughts in my head when you said that. I'm like, wow, I resonated with that quite a bit.
Yeah, I mean, you think about it, a lot of what we do is because somebody somewhere may ask a question in 5 years about this chart of this patient, or anybody can sue for anything these days, right? And So you're almost documenting to defend what you did as opposed to having the freedom to just be present with the patient, to listen to their needs, to see them as the whole person, and to be able to meet the needs and to coordinate with whoever else they might need that will help them. And all the things that we want to do as an interdisciplinary team within healthcare, all of that gets shortened because I didn't check that box in that field that whatever regulator wanted me to check.
That's a powerful statement there. That, like you said, that is a big conversation too, in of its own.
Oh my gosh.
I think that's a like, I mean, we all catch ourselves doing it. Even it's like, what's the one thing I see in every home health chart at the end? Vitals within normal limits, and patient is all good. Like that's kind of what you're saying is we're documenting all these things for the chance that maybe in the future something might happen and we need to protect ourselves because of how happy people can be, but that might backfire too, because we all know that the best way to prevent that is to, engage your patients, make your patients like you, give good quality care, get them to their goals. So I don't know, tough questions.
It really is. And I'm just thinking about it because, I mean, you're right. It's to protect ourselves. The last time that I saw this patient, they were stable. This is the way I left them. And like you said, in home health, there's no witness unless the patient has a family member, and that family member is on the side of the patient. So, a lot of times the therapist is having to think from how do I protect myself versus how am I free to do my best work?
Yeah.
I want to pause for a moment to share something with you, my friend. After landing several non-clinical roles and coaching others to do the same, I have found that if you're running into roadblocks, making that pivot out of direct patient care, it's because of one of three reasons. One, you haven't quite figured out what you want to do yet, and that's okay. But take the time to dive deep to figure that out. Number two, your resume screams clinician. And number three, you haven't demonstrated value and impact in your current role. Regardless of which reason resonates most deeply with you, I'll share some resources to help in the show notes section of this podcast.
You just hit like a good point on the work that I'm doing outside of my full-time job regarding AI is, one of the barriers we were going to face is we have this transcript that's being generated by AI and being combed for specific components related to quality that might drive some good initiatives. But one of the barriers we knew was going to arise from that is, how do clinicians feel about being recorded during their visit? And so but I think you hit on the win there, in the positive is that, well, it protects you because, if the patient was going to come back and say, you did this or you didn't do that, or you treated me this way, or you said this to me, you have a protection there. You have something that prevents anything and everything because there's a hard record of what happened. I don't know if that's something that, clinicians view as positive or not.
Yeah, and it remains to be seen, but I could see how the clinician would think, oh, they're watching me, they don't trust me. Mm-hmm. But on the flip side, it's a protection so that you can do your best work. And so if you have that patient who is a little combative or aggressive, or if it becomes the patient's word against your words, you have a record of what happened, and it's not you by yourself. It's not your word against their word.
Yeah, absolutely. And the ultimate goal is really just to look for things like, was a med rec done? Were vitals taken? If the patient has CHF, were they weighed? If the patient mentions that there was a change in status, like, hey, I'm not feeling too good, or I've thrown up the last few days, was there follow-up with the physician? Did the clinician call the physician? So that's what we would really be looking for with using that technology. It's not so much to berate the clinicians on did you do this or not to the down to the little nitty gritty details or anything.
Yeah, and if it could help with documentation, so that if I'm the clinician and I didn't have to remember
Hmm.
everything the patient said, like if I happen to miss something, they said something, and I was thinking about the last thing they said, so I missed that nuance of what they shared, then it's documented and I can go back and see, oh my gosh, they did tell me they had a change and I totally missed it. Let me do something about that.
Yeah, that's a great point. Yeah, having that reference document to go back, or even a Cliff Note version can be helpful to clinicians when they're documenting and they're like, I forgot. Did they have this assisted device? Did they not? Having maybe a record of stuff that happened in the home is useful to them for even accuracy with documentation.
Yeah. Well, I'd be very interested to see where this goes. I'm glad that you're able to be a part of it, especially because you have a process driven mindset and you can think through those kind of things, not just, this is in a secondary role, but I think the skills that you have from the first role is really going to help you in this next
Yeah.
venture. I'll call it a venture.
You call it adventure, yeah, or that's a good word for it. I'm going to start using that going forward. But I agree. And that goes back to this whole discussion we've had too, is something people can take from it is skills build on skills. You don't know what might be complementary to what you already have or what you will have in the future. And I think there's an actual term for this. Don't quote me, but like skill stacking.
Mm-hmm.
I think
Mm-hmm.
it's a real thing where you can look up and see what skills stack the best, so to speak, to combine together to make you a really well-rounded individual.
Yeah, and the opportunities that's opened up for you, Cody, because when you first started this journey towards healthcare quality, I don't know if you were even thinking, I might work in AI one day.
Absolutely not. Absolutely not. And I think I just got this role and started working here. And that leads to people reaching out on LinkedIn because now you have an expertise. And that's interesting too, right? And I would love to hear your thoughts on this, but as a PT, no one was reaching out to me.
Right.
As a quality director who was a PT who is doing other stuff now, it's like people want your ear. And just that title change, that little bit of experience, all of a sudden you become more valuable than you were as someone with a doctorate degree.
Yeah, you become a thought leader and they do value your expertise more. I agree. I get direct messages frequently about my expertise or my thoughts on a certain thing because of the roles that I've had in the past. And so it is interesting. Before I started the journey, I wasn't getting as much, as much attention.
Right. But you would think that your skills as a PT would be extremely valuable, but the market for your skills is just patience. And I think like the market for, other non-clinical skills is much larger, like business, marketing skills, quality skills, like those skills transcend an individual patient experience. So that's where you get these other individuals coming in. Hey, I'm starting this startup company. I need some advice or some input as someone who's in quality or business. And that's very unique. And especially if you're a clinician who has now transitioned, you can give advice on both aspects and both roles.
Yeah, and really changing the narrative. You said when you're in the clinician role, as a physical therapist, at the bedside, that's what people see you as. They don't see all the other skills that you add to the table. But that's one of the goals of conversations like these is to change the narrative because it takes a certain type of person to want to be a therapist anyway.
Mhm.
And then the skills that we have translate into so many different areas: business, finance, marketing, sales, things in and out of healthcare, right? And so it's changing the narrative for how people see the expertise of the therapist.
Yeah, and that's interesting that you bring that point up because I had a similar conversation with someone that I don't directly work with, but someone within my company. As I've been going through their leadership development program, I made new contacts and such. And one of them was an OT, and we had a great conversation, kind of similar around the same topic, is you have to change people's view of you, especially as a therapist. And she had made the comment of, we don't see us up here, you know? And it's true. When you see someone who's a therapist in a different role or maybe an elevated role, you're like, how did you get there? And you kind of have this little like, hey, you're up here, like, I'm a PT too, or I'm an OT or speech. And you're like, how'd you get there? Can you help me get there? So there's this kind of like inner camaraderie too. So I really encourage therapists looking into specific roles to like look for that PT or look for that OT or look for that speech therapist in that role. They're out there, and you will probably get a better interaction from those individuals than you would just anyone else in the role. Like that's one of the reasons I reached out to you to begin with. Specifically, I saw you were doing the quality stuff, but I saw you were a PT. So I was like, okay, like there's that connection.
Absolutely. And, I think the other thing to say is it's taking our own selves out of not putting our own selves in the box.
Mm-hmm.
Right. Because we put some self-imposed limits on ourselves, and seeing other people in roles, like you said, when you see, oh my gosh, there's an OT in that role. Can you help me? Can you be my friend? Can you show me how you did it? It shows you that there are other avenues, and that if they can do it, I can do it.
Yeah. Yeah. I mean, you just saying that is like, get out there, go on LinkedIn and just search up Senior Vice President PT in the LinkedIn search bar. You'll find senior vice presidents who are PTs out there. You'll find them that are probably OTs too. And like, just look at that and convince yourself that you can go that way. You can get out, you can go that direction.
Well, I just tell you, Cody, this conversation has been phenomenal. This has been awesome talking to you about all of these things. And I know we could continue to talk for a long time, but let me say, how can people connect with you?
Yeah, the best way to connect with me is going to be through LinkedIn. I'm on there pretty frequently and I engage on there quite a bit. So that would be the best place.
All right. Well, I will put that link in the show notes for you all to click on to connect with Cody. And like Cody said, don't hesitate to reach out to people on LinkedIn, do a search by title and include their clinical credentials in there, and you'd be amazed at what you find. But thank you for joining us today. Thank you, Cody, so much for being here for this conversation. The only word that I can think of to fit is phenomenal. This has been an excellent conversation. So I appreciate you for being here. Absolutely. I'm glad to give back in a way that's meaningful, because I think, that's our reason. If you make it, turn around, put that hand out for someone else. Absolutely. Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.